Good morning, fourth stage medical college. Our lecture today about pyrexia of unknown origin. This is hot topic, very important lecture. We start with this slide. What is the commonest cause of pyrexia of unknown origin? A, B, C, D. Common disease presenting a typical way, rare disease presenting in a typical way, common disease presenting typically, rare disease presented typically. This is for you. So the answer is A. The commonest cause of PUO is common disease presenting atypically. يعني مثل واحد عنده تي بي بدنا نلقى تي بي باللنج just PUO بما انه احنا endemic with TB, so the commonest cause of PUO is common disease. شو جانا ابو التي بي؟ جانا PUO، ما جاني كف وفيفر وهيموبتيسيس. This is an example. Terminology, epidemiology, diagnostic, therapeutic, and the outcome. What about terminology? Fever more than 38.3 on several occasions, duration more than 3 weeks, uncertain diagnosis, new definition, 3 outpatient visit 3 مرات مراجعنا بالعيادة الخارجية أو 3 days in hospital with all the investigation negative, or 1 week intelligent invasive ambulatory investigation, all are negative. We have classical PO, nosocomial, means acquired during hospitalization, neutropenic, those patients with low white PC or neutrophil HIV associated, and transplant. Epidemiology and etiology, category of illness causing PO infection, still at the top of the list, followed by malignancy, connective tissue disease, miscellaneous, and still there is 10 to 15% undiagnosed. The remaining or the majority of disease remaining after initial negative workup are tumor, connective tissue disease, TB, drug addiction, SPE, subacute bacterial endocarditis, elderly also with endocarditis, HIV, prosthetic device infection, and history of traveling, very important. In healthy adult men and women, the range of normal temperature is between 33 to 38.2. For rectal, it is 34 to 37.8. For tympanic, 35, 37.8. Axillary, 35, 37. What is the base site to measure temperature? Definitely it is the rectal. Neutropenia based on the absolute neutrophil count, not white PC count. Usually mild, moderate, severe according to the white PC count, below 1000, below 1000, below 500. Neutropenic fever without source usually end with bacteremia. Fever lasts more 7 days. fungal infection يعني من يجينا patient white PC مالته او النيوتروفيل اقل من 1500 fever حطيته antibiotics ماكو response. After 7 days you should exclude fungal infection as a cause of neutropenic fever. Etiology, as I mentioned, infection, 3 major cause, abscess, occult abscess. Where is occult abscess? Perinephric abscess, subdiaphragmatic abscess, intracellular organism, Salmonella, Mycobacterium, Procilla, and intravascular subacute bacterial endocarditis. So these are the 3 main causes of PUO as infection. Malignancy, what malignant disease presented as pyrexia of unknown origin? Lymphoma at the top of the list, leukemia, multiple myeloma, renal cell carcinoma, hepatocellular carcinoma, or any malignancies causing secondaries in the liver. Cancers, top 5 cancers, lymphoma, leukemia, liver, renal, colonic cancer, sarcoma, and never forget arterial myxoma as a cause of PUO. Lymphoma, الفيفر مالتها well recognized associated with the activity of the disease. بعض الأحيان نسميها Paul-Epstein fever، هاي cyclic fever يعني كل 10 أيام تعيد، كل 10 أيام patient febrile بعدين تجي الفيفر. 20% of patients with RCC presented with fever. Wilms tumor, disease of renal organism in children. Solid tumor, fever is rare except when there is secondary in the liver or ductal obstruction or lung carcinoma with superadded infection. Collagen vascular disease at the top of the list is vasculitis, Behçet disease, systemic lupus, giant cell arthritis, especially in elderly, still disease in young age group, and relapsing polychondritis. Temporal arteritis, very serious condition. Why? It will cause blindness as if it is untreated, typically affecting Caucasian population, and can occur in others. Fever, malaise, maybe the only manifestation. Headache is most common, and usually need biopsy for the temporal artery to diagnose. Treatment is usually steroid. Careful questioning, jaw claudication or visual loss. If there is any explained fever, this is jaw claudication or visual loss and temporal arteritis. Unexplained fever, anemia, high SR, elderly without obvious cause, you should exclude malignancy. Unilateral versus bilateral, short versus long segment, and treatment for more than 2 years. Polymyalgia rheumatica. Polymyalgia rheumatica, it is rare, mainly middle age or elderly female, high SR, muscle pain, and usually those patients responding also well to steroid. Other vasculitis cause BO, polyarthritis nodosa, Wigner granuloma, and mixed cryoglobulinemia. Mesoneous cause, non-infectious pulmonary embolism, can present with fever, hematoma in a closed space. يعني واحد retroperitoneal hematoma after injury and hematoma, any hematoma whenever it will resolve, cause fever. Adrenal insufficiency, some patient with Addison disease, primary adrenal insufficiency, and can present with fever associated with nausea, vomiting, low blood pressure, low sodium due to high potassium due to low corticosteroid. Familial Mediterranean fever, this is a patient with Jewish in origin, mainly could affect Arabian population. Recurrent fever and serositis, all the investigation negative. يعني يجي البيشنت pleurisy, abdominal pain, and most of patients operated for appendicitis, and the result was negative. Diagnosis by exclusion. What about alcoholic hepatitis? It is very important, elevated liver enzymes, and very important history of alcohol ingestion is very important. Other causes, factitious fever. جندي يريد ياخذ اجازه، شلون يقول انا مسخن؟ يقوم يضرب نفسه جوا الجلد ابر، اي ابره صح، نورمال سلاين، عاده يضربون كيروسين، نفط، تجيب نفط 1 سي سي تضربه جوا الجلد، شو يصير عنده؟ يصير عنده رياكشن، فبراير رياكشن. Those called factitious fever, induced by the patient, and could be induced by nurse. بعض الممرضين او المرضات ياخذون ثايروكسين على مود زيت basal metabolic rate ويسوي fever. Clue to the factitious fever: patient history, work, bizarre temperature chart, temperature usually high, more than 41, absence of sweating, normal ESR C-reactive protein, and there is always evidence of self-injection. You should examine the patient carefully. Drug fever, any drug can cause fever. وايد يجون المرضى عنده سخونه وجايب علاقته بها كومة ادويه، شو اقول له؟ اقطع الدواء 48 ساعه وشوف حرارتك تروح لو لا، وبالفعل تروح ورا يومين. HIV associated fever, يعني either activity of the disease alone or drug induced or complication of disease itself. Diagnosis, careful history, physical examination, and diagnostic test. Very important, history of fever. We should insist on taking detailed history from the patient to exclude what we call factitious fever, or for persistent fever for more than 1 month. Duration of fever, very important. The longer duration, the less likely to have infection and malignancy. It's very important. Usually we said months, not weeks. History, traveling to the area endemic with infectious disease like malaria, plague, dengue, and salmonella, and other disease, and these are the incubation period for these infectious disease. History of drug and toxin history, drug-induced fever, very important. اكو ادويه مثل انتي هيستامين، الارمين، الانتي تي بي، نون ستيرويدال، is very important to be mentioned during history taking. Localized symptom, backache, TB spondylitis, headache, chronic meningitis, giant cell arthritis, right upper quadrant, liver abscess, قد يكون hydatid cyst infected, splenic abscess, hydatid cyst infected, oral genital Behçet disease, and jaw claudication, temporal arthritis, and septal change in behavior, glomerulomatous meningitis. Family history, very important. History of TB, family history of familial Mediterranean fever, transit families. Past condition ناخذ history الميشت. عندك قبل مرض مؤذيا، عندك سرطان قبل، لمفوما، عندك حمى روماتيزية، عندك vasculitis. Sexual history very important in the reproductive age group, and drug abuse are also very important in the history. Physical examination, you should look for the key physical sign, diagnostic yield, document the fever. يعني ماكو واحد يقول انا مسخن وتقيس حرارته بتطلع نورمال. هذا ما نخليه بالكاتيجوري مال بي او فيفر. Fever is a must. Analyzing pattern of fever, tertiary and quadrant pattern. هاي tertian and quadrant يعني يومين يسخن، ثالث يوم ما مسخن. هذه تصير بالملاريا، بابستين، ليمفوما، تي بي، pulse temperature dissociation, typhoid. هاي دائما نحكي. For each 1 centigrade increase in blood in body temperature, there will be an increase 15 heart rate. يعني ابو التيفو مثلا نحكي بالعاميه، ابو التيفو من يجي مثلا حرارته خلينا نقول 40 نلقى النبض مالته 85 او 80، هاي يسموها ريلاتيف براديكارديا. ريلاتيف براديكارديا ما قاعد يصعد حسب الحراره اللي تصعد. هذا فد شيء كاركترستيك اوف تايفويد فيفر. زين. physical examination. نستمر lymph node enlargement, lymphoma, infectious mono, TB, lymphadenitis, bacterial, supraclavicular lymphadenopathy. You should exclude malignancy. consistency stony. طبعا consistency نقصد بالليمف نود، عادة بالليمفوما تكون ربري مثل المطاط، ممكن تكون firm in consistency بالinfection، hard بالmalignancy. matted together وربري هاي most likely lymphoma. لا تنسى تفحص الثايرويد as a cause of fever. thyrotoxicosis ممكن تجي fever. examine the skin rash to exclude infectious mono, SLE, stall disease, endocarditis, typhoid fever ممكن يجي nose spot rash. osler nose اللي نشوفه بال SBE. هاي الراش اللي موجود بال SBE bacterial endocarditis. examine for oral ulcer مهم بالبهجت disease والSLE. examine for arthritis, fundus examination, looking for rough spot اللي نشوفه بالاندوكاردايتس. yellowish white choroidal lesion, TB, chorioretinitis, toxoplasmosis and HIV patient. new or changing murmur, this is indication of bacterial endocarditis of the valve. sinus tenderness, sinusitis, tender tooth, tooth abscess. شنو المشكلة يسوي لنا fever. temporal artery nodular weak, pulsatile هذا نشوفه بالtemporal arthritis. thyroid enlargement or tenderness, calf tenderness, DVT, and nails for feature of SBE, subacute bacterial endocarditis. blind application leads to excessive NOF test. حاول التحاليل تكون يعني مركزة على البيشنت هيستوري والفيزيكال فايندينج، مو نسوي له تحاليل اعتباطية. complete looking for anemia and leukocytosis, infection, lymphocytosis, viral infection, leukopenia, lymphopenia, HIV, leukoerythroblastic picture, TB, thrombocytopenia, malaria, leukemia, peripheral blood-borne malaria, and this is atypical lymphocyte اللي نشوفها هاي بالinfectious mononucleosis. This is leukoerythroblastic infection, hypersegmented neutropenia نشوفها بالchronic infection like TB, urine analysis, UTI, common cause of fever, especially pediatric and elderly, ESR, high ESR elevation, TB, multiple myeloma, temporal arthritis, could be infection, could be malignancy. C-reactive protein usually does not go up with عادة نستخدمه كفحص انه يميزلنا هذا inflammation or bacterial infection. C-reactive عادة ما يصعد viral infection. else شوي محاضرة طويلة بس هي interesting. diagnostic test protein increase protein decrease, fibrinogen, albumin, and transferrin. Albumin, transferrin are decreased, and with acute phase reacting protein, fibrinogen, ferritin, and these are marker of acute inflammation. In summary, blood test: ANA, rheumatoid factor, monosport test, tuberculin test, thyroid function test. كل هاي لها علاقة بالclinical presentation and history of the patient. ما ننسى blood culture, searching for infection, mainly enteric fever, brucellosis, and SBE, sputum for TB, and CSF or peritoneal fluid, searching for TB and even brucellosis. Imaging study: miliary shadow, chest X-ray, miliary TB, atelectasis, pneumonia, mediastinal mass, lymphoma, or other infectious causes. CT: mediastinal mass, dorsal spine, spondylitis, could be brucellosis. CT abdomen for any abscesses, heading abscesses. MRI spleen, liver, and even brain. أتذكر مريض PO كان عنده chronic otitis media، طلع brain abscess لأنه diabetic، شخصته بالبرين CT. وأكو مريض لما كان PO abdominal CT subdiaphragmatic abscess. يعني نستخدم sophisticated test whenever we have not reached the diagnosis yet. Serology: Brucella, virology, antinuclear factor. radionuclear scan لازم نخليه بالأخير طبعا. bone scan, osteomyelitis, gallium scan, an inflammatory condition. white PC scan for searching for abscess. Serological test: autoantibodies, immunoglobulin, complement, and cryoglobulin. اكو شيء اسمه ثيرابيوتيك ترايل؟ اكو شيء ثيرابيوتيك ترايل؟ يس. يعني شنو ثيرابيوتيك ترايل؟ يعني هو PO مدى اوصل التشخيص، بس انا ببالي فد شيء. يعني شنو ببالي فد شيء؟ ببالي connective tissue disease، مخلي at the top of the list مدى يطلع diagnosis. yes trial of steroid. ممكن ببالي روماتيك فيفر، بس التحاليل ما قاعد تشخص لي روماتيك فيفر. trial of aspirin. ببالي بروسيلوسيس، بس الروزبنجل مدى يطلع بلوكينج انتي بودي، اعطي ترايل مال بروسيلوسيس. موجوده هاي بالميديسن، بس لازم يستخدمها well expert physician and the patient is very sick، وناخذ الاجريمنت مالته. ممكن نسينا نقول ثيرابيوتيك ترايل. يس، انا جتني يعني امراه جلدتها PO، ماكو اي سبب، بس هم ان اريا انديميك والتي بي، بديت لها انتي تي بي اسبوعين، صارت كل زينه، مشيت لها العلاج لمده 6 اشهر. زين. outcome: if the cause of fever remain elusive، غير معروف، نعيد ونصقل بالتحاليل والهيستوري. ممكن 15% من الحالات ترى ما نوصل تشخيص، والمريض ممكن يطيب بوحده او بعدين تظهر الامراض. عاده يطلع لنا هيدن مالجنسي عاده اذا ماكو diagnosis بالبدايه. and diagnose PO patient have recovery ممكن 80% 4 اسابيع، recovery in 2 years time 90%، required steroid or non-steroidal 10%، mortality rate 5 years after discharge is 3%. overall mortality of PO هي تصل 40%، عادة سببها المالجنسي والelderly comorbidities. if no cause found, the long-term mortality is low and fever often settle spontaneously. Thank you.